Well, ladies, I think I'm going to begin, and I'm just going to say, first of all, welcome and thank you for joining us for this very important subject for so many of us within the Ethel Gathering Group. And I'm very appreciative of both Dr. Guglin and Francesca for allowing us to do this today. And I thought I would just begin by saying, we had 15 or 16 items on our poll back on June 27th. And I have about the top 10 or 11 items that you checked off. And we will be discussing that today. And please feel free to ask questions. I'd like to just start off by saying, welcome, Dr. Guglin. We're in his offices right now in Milford, Connecticut. And I wanted to just read to you his bio because, I know Dr. Guglin because I came here for the MCELA, which we can discuss as it relates to incontinence issues. So let me just check. Can everyone hear me okay? Thumbs up? Okay, great. Thank you. So Dr. Guglin is here with us today. He was born and raised in Rochester, New York, after receiving a BS from SUNY at Albany, New York. He went on to medical school at the University of Pittsburgh School of Medicine. He underwent general surgery residency training, initially at New Britain General Hospital in New Britain, Connecticut, then finished a trauma fellowship and wrapped up his general surgery training at Hartford Hospital in Hartford, Connecticut. He's been a practicing acute care general surgeon in Milford, Connecticut for 28 years. Toward the end of his tenure, he became somewhat dissatisfied with medicine, the way it is typically practiced in this country. It has become the norm in part because of the undue influence of the insurance and pharmaceutical industries to allow patients to become chronically unhealthy, mostly as a result of lifestyle issues, then to treat their symptoms with pharmaceuticals or invasive surgery. At that point, he became impassioned about the newer concept and the field of preventative functional medicine. Practitioners in this field are dedicated to finding the root cause of chronic illnesses through the use of advanced diagnostics, including extensive blood studies, genomics, body composition analysis, VO2 max studies, and cognitive testing. Clients then sit down with their physician and formulate a comprehensive plan, including nutritional counseling, age and fitness level, appropriate physical training, nutraceuticals, hormone optimization, and stress reduction strategies. Dr. Guglin feels that this is the best way to approach the achieving wellness, no matter what age or state of health you are in presently. He understands that only through hard work and dedication to achieving your personal health goals, along with the education and medical assistance, HyperFit MD can provide a dramatically improved health and quality of life. That being said, I would love to let Dr. Guglin take over. We've got quite a few topics for discussion. And again, if you have questions, please don't hesitate to let us know.
Sure, absolutely. First of all, that's the longest bio I've ever heard in my life. That must have come from a website or something. It's since this is an AARP thing, I'm assuming that most of the people that we're discussing with here are of an age. Let's just say that. How's that? All I know is that I was saying before that I got my first letter from AARP when I was 50. So I'm assuming that most of the people that we're talking to here are that age or older. One of the things we do one of the things that we kind of try to emphasize in our practice is we see people from 18 to 100, but I would say the majority of people that we see in our practice are people that have been abandoned by the allopathic healthcare system to a large degree. Allopathic healthcare is what we think of as healthcare in this country. MDs and DOs are allopathic physicians. And once we reach a certain age, they basically give up on us. I mean, how many people have gotten the shrug of the shoulders from their physician and been told, well, you're just, you're getting older, you have a list of symptoms or a list of healthcare issues that you want to address. For the most part, you get about 7 to 12 minutes a year with that physician that him or her will go through your list of medications that you're currently on. And by the way, in America, pretty much on average, the 65-year-old patient in America is already on 10 pharmaceuticals, whether it is prescription medications or over-the-counter medications. These are statistics that have been gleaned from insurance industry data. And what we get as we get older is this whole idea of being abandoned by the healthcare system and given mostly pills for our symptoms. And what this practice is about, and what the whole concept of age management is about, is trying to abandon that focus on pharmaceuticals and help people to get better. Because when we think about what befalls us as we get older, much of it is related to health, to lifestyle. How many people have been addressed by something? I mean, we think about this in America, carrot cake is a health food, right? Because, you know, eat your veggies, right? So for the most part, once we are of a certain age, it's considered perfectly normal. Let's put it that way. It's considered normal in the allopathic healthcare system to just fall apart for the next 40 years. We are really good in this country at keeping people alive until 90. But frankly, we suck at keeping them healthy. And what our practice is all about, and the whole concept of age management is about health span, not so much lifespan. Now, a lot of this has to do with the failure of our endocrine system that occurs when we get to a certain age. And we'll talk about that a little bit later. But also, much of what befalls us is not only age related, but also health, lifestyle related. All of us, I'm 68, so anybody who is my age or maybe 10 years younger remembers when all of a sudden fat was bad. Remember in the 70s, fat was bad, and we eliminated fat from our diets and we replaced it with what? Sugar, right? Sugar is the evil that has befallen health patients in this country for the last 20 or 30 years. And I can tell you right now that probably 50% of the people that come through my door are already insulin resistant. Now, insulin resistance is the first stage of adult onset diabetes. And we are in the middle of a diabetes epidemic in this country right now. And your doc is basically waiting for you to get diabetes because he's got a pill for you. He's got a pill, or he's got insulin, he's got some kind of medication to help you manage your blood sugar, when in fact, if a physician had caught your insulin resistance much earlier in your life, it can be affected. It can be, I don't want to say we cure anything in our practice, but we, by helping people with lifestyle, hormone optimization, getting them moving. What a lot of what we see in a practice like this is sedentary individuals who have suffered the ills of just not moving. And what do we get from our doctor every year? We get those 7 minutes. We get an opportunity to give him a catalog of our symptoms. And while we're having that conversation in an algorithmic way, that physician is trying to think of different medications he can give you for each of your symptoms. The age management community and the integrated medicine community is really much more about trying to uncover the underlying cause of those symptoms so we can affect those underlying causes long before they become a clinical illness. Menopause. What is menopause? Menopause is primary ovarian failure. Women go through menopause. Men go through andropause. Women go through menopause. Takes you guys about a year or so. You feel the symptoms acutely. You have hot flashes, you have mood swings, you have sexual dysfunction, all of the changes that occur with ovarian failure occur within a year or two. And then, like I said, in the allopathic healthcare system, you're just going to fall apart for the next 40 years with no help at all based on that. Men, we go through andropause. It takes us about 10 to 15 years to go through andropause. So we just we very slowly get old, fat, and crabby for the most part. And so it's kind of a different evolution. but the end is the same. Classic example, a woman goes through menopause. She loses about 10% of her muscle mass every 5 to 8 years from that moment on. If she's not on estrogen and testosterone and doing some level of using her muscle mass, she loses about 10% of her muscle mass every 5 to 8 years. What is the principal component that your resting metabolic rate, which is the number of calories that you burn per day sitting in a chair, is affected by 3 separate things. Number 1, your muscle mass. Number 2, your thyroid hormone levels. Number 3, critically important, is the number of calories that you consume per day. Now, what are women really good at that men are terrible at? Caloric restriction. You guys are amazing at restricting the number of calories that you take in per day. Let's say you want to get into that mother of the bride dress, okay? You got a month to get into that dress. You got a month to lose 20 pounds. Let's say at the beginning of that journey, your resting metabolic rate, the number of calories that you burn per day, is 2,000 calories. So you say, okay, I'm going to limit my caloric intake to 1,200 calories. So you limit your caloric intake to 1,200 calories for that month. You successfully get into that dress. You're a miracle that's happened. Everybody who comes in from the family says, man, you look amazing. You look really good in that dress. The day after the wedding, you go back to eating 2,000 calories. But guess what? Your metabolism has reset your resting metabolic rate to 1,200 calories, and it stays there. So during that 20-pound journey, you've lost about 15 pounds of fat and about 5 pounds of muscle mass. Your body has reset your metabolic rate. So now you're eating 2,000 calories a day. You started out with a percent body fat of 30%. You gained back 20 pounds of fat, and now you're back to the same weight. Your resting metabolic rate is now 1,200 calories, and you are 35% body fat. You've heard about yo-yo dieting, and that's what it does to us, okay? The yo-yo dieting does that to us, and menopause brings that on us because the principal cause, ovarian failure, decreases and drops to 0 the level of estrogen in your bodies and the level of testosterone. Women don't talk about testosterone. Your doctors don't talk about it. Testosterone is critically important to female health. It is a fat-burning, muscle-building, bone mineral density supporting, sexual function supporting hormone that women become bereft of at menopause. And what happens? We turn into an apple, okay? Men, the same thing. We accumulate belly fat. I can go on and on about this stuff. But the fact of the matter is that ovarian failure, endocrine failure, is one of the things that bring on the slow degenerative changes that occur with aging. Bone mineral density, loss of muscle mass, accumulation of truncal fat, the stuff that happens around our midsection, okay? Sexual dysfunction. How many times do I hear in my practice from a woman, I love my husband, but I just don't have it for him because they have no libido. When we do have sex, it's painful, or I start bleeding or something like that. All of these things occur as a result of hormone failure as we get older. Thyroid, the principal hormone that brings energy to our bodies, is an organ that gets tired as we get older as well, and we never hear about that. One of the problems with the allopathic healthcare system, and I'm not bad-mouthing GYN doctors, but you guys are third-class citizens in healthcare because we've abdicated your care to the GYN community. Now, these guys are really good at helping us deliver our babies, right? They're really good at taking out our stuff when it's not working for us anymore. But with the stuff, for the things that befall us with age, the GYN community is either not interested or they're not trained to take care of it. This is highly specialized training, and quite frankly, they don't get paid by insurance for it. So it's not something that they're fundamentally interested in. So what do? You complain of the symptoms of menopause, and they'll slap an estrogen patch on you. That estrogen patch in isolation does several things. First of all, it puts you at risk for breast cancer and stroke. Secondly, it treats one thing. It treats the symptoms of menopause, hot flashes, so on and so forth, yada, yada. We've been through it. Okay, what are the symptoms of menopause? Hot flashes, night sweats, vaginal dryness, How many women out there have a desert wind coming off of their vagina, okay? Because basically you get to a certain age and it's not just functioning for you anymore. Weight gain, we've talked about that. Every single person to a large degree that comes through our front door complains of two things. I'm fat and I'm tired, okay? I mean, this is America. We're all fat and tired. We're all overweight and we're all fatigued chronically.
Right.
These are all things that occur with age that gets no attention paid by the allopathic community. Muscle mass loss, joint pain, dry skin, changes in body composition, which we've already talked about. All of these things befall us as you get older, and the allopathic healthcare system has absolutely no help for us. And this is why I took on an encore career doing what we're doing right now. I gotta be honest with you, I paid $65,000 for marketing in 2021. In 2023, not a single penny, because it's word of mouth that's driving this practice right now. It's just happy people. Excuse me. And I have to emphasize this. The science has been done about this stuff. Most of what I do in my practice is myth busting. Go ahead.
Bioidentical hormones.
Yeah. This is Francesca, by the way. I'm the engine that drives the practice and she runs the wheelhouse. She's the captain, okay? She does all the work. I sit on my ass in this chair and just do doctor stuff. She's the main reason why this practice is successful. And she's reminding me, we're going to talk about that in a minute. So the science has been done about this stuff. There's randomized prospective, peer-reviewed science that clearly supports the optimization of hormones in old age. And what am I talking about? I'm not talking about Premarin and Provera. I'm not talking about the hormone analogs that the medical community has been literally poisoning women with since the 1970s. I'm talking about bioidentical isomolecular hormones, exactly carbon for carbon, the same hormones your body was cranking out for 40 years, okay? And we were just talking about this earlier. She has a friend that overheard her talking about this particular thing. And this friend said, well, this is not natural, right? I'm saying, and I hear this all the time. I want to age naturally. And excuse my language, what the hell does that mean? You know, you guys have been taking a bath in these hormones for 45 years, and all of a sudden it's considered by the allopathic community unnatural for you to be taking these hormones into old age. And the secret to this is the bioidentical aspect of hormone replacement, all right? Estradiol. Estradiol is critically important to your health. Bone mineral density, cognitive function. How many times do I hear brain fog, okay? I'm a lawyer. I have to get all my stuff done in the morning because in the afternoon, my brain is simply not working for me. Cardiovascular disease. Probably the most cardioprotective substance on the planet Earth is estrogen, okay? One of the reasons why you guys live longer than we do is because, well, you want to and we don't care. But part of it is also the fact that, again, you're taking a bath in estradiol for 40 years. That stuff melts plaque. The average female who does not have a familial component to cardiovascular disease literally does not start making plaque until she goes through menopause. And we see this. The Framingham study that's been done on heart disease since the 1990s, the Framingham study clearly shows that when you take a woman who, if you do a carotid intermediate study, it's called a CIMT study, it's an ultrasound of the carotid artery, 10 years after menopause, it clearly shows that there's formation of plaque in that carotid artery. You start that woman on estradiol, bioidentical estrogen. It takes a long time. It takes 4, 5, 6 years. And you repeat that CIMT study on a yearly basis, you start to see that plaque resolve. It's clearly shown in the Framingham study that this is actually what works, okay? The men in my practice are on testosterone. Some of their testosterone is aromatized into estrogen, and we allow that estrogen level to come up because in men, estrogen is a mood modulator. It keeps us from being jerks. And number two, it's as cardioprotective in men as it is in women. Sexual function, estradiol is critical to vaginal mucosa. The lining of your vagina is critically important to estrogen to maintain the robust nature of that tissue. As you go through estrogen withdrawal, the mucosa of the vagina atrophies, it becomes thin, prone to injury, and then it contracts over time. An 8-year-old woman who's not been on hormone replacement, who's 20, 30 years past menopause, literally cannot have sex, number one. Number two, chronic urinary tract infection. Number three, urge incontinence, stress incontinence, the failure of the levator muscles, the pelvic sling. And we may talk about that a little bit later. I mean, we'll see about that. People have questions about it. So estrogen is critically important to your health. It's critically important to the vast majority of symptoms that come to us post-menopause. Progesterone is the key, though. Your GYN doctor will tell you that if you've had a hysterectomy, you do not need progesterone, which is about as untrue as it possibly can be, because every single cell in your body has progesterone receptors, especially your brain, your heart, your breasts, the solid organs of your body. Progesterone is the key because progesterone protects in a very large degree against the stimulatory effect of estradiol, especially on the breast tissue. If you literally, if you pour progesterone, I'm talking about bioidentical progesterone, not progestins, Provera, which is what GYN docs have been giving women since the 1970s, the only cells in your body that have receptors for Provera are your uterine cells, which is why this myth about breast cancer and estrogen has been on and on and on and on since the 1970s, because physicians have been giving women Premarin, which is a bench-made hormone that is a conjugated equine estrogen. It is literally made from the urine of pregnant horses. This stuff has no similarity whatsoever to bioidentical estradiol. They've been putting women on Premarin. If they don't have a uterus, that's all they've been putting them on. Huge level of estrogen dominance in their tissues. And even if they put them on a progestin, which is Provera, which only has effect on your uterus, they are still putting you in systemic estrogen dominance, which puts women at risk for stroke, breast cancer, all the things that have created this myth about hormone replacement in old age. I'm sorry.
No, I'm
I thought you had a
agreeing.
question. Yeah. Which is why the bioidentical nature of this is critically important. So your GYN doc will tell you if you've had a hysterectomy, and I'm 68. Every mom in my community had a hysterectomy. Remember those days if you farted sideways, the doctors took your uterus out, right? They took out all your stuff, and what would they say to you? Look, once you're done having all your children, all it's there is just sitting there to make cancer. Let's get rid of it. We've all heard that, okay? And once that uterus was gone, those women were being treated with bench-made estrogen, which was creating this whole thing about breast cancer, stroke, which is true about Premarin and Provera, not true about bioidentical hormone replacement, okay? So progesterone is the key, because progesterone is the balancing act with estradiol, and this stuff needs to be followed. It needs to be followed very closely. Objective data is how we run this kind of thing, okay? Progesterone, by the way, is the best sleep medication on the planet. Let me say that again. The best sleep medication on the planet is progesterone. What's another thing that I hear every day in this practice? I'm fat, I'm tired, and I cannot sleep. I fall asleep fine, but I wake up 2 hours later and I cannot get to sleep for the rest of the night. Progesterone is why you guys slept fine for years and years and years, but then post-menopause had difficulty sleeping. So progesterone is critically important to all this. Testosterone. We think of testosterone as a male hormone. Testosterone is critically important to women's health because what does it support? Muscle mass. There's two things that codify quality of life, longevity, and health into old age. Number one is your muscle mass. If you lose muscle mass, which you're going to lose about 10% every 5 years post-menopause, you're going to die of a fall, okay? Muscle mass, bone mineral density. You're gonna lose bone mineral density without testosterone. Sexual function. An average woman, 5 to 10 years post-menopause, becomes anorgasmic because the clitoris atrophies and you can't have orgasms anymore because the clitoris is not functioning. 6 months on testosterone, the clitoris comes back, a woman becomes orgasmic again, her libido comes back within a few weeks. The whole aspect of vaginal dryness and stuff like that between estrogen and testosterone comes back. So testosterone is critically important for libido, bone mineral density, maintaining muscle mass, cognition, fat loss. Fat loss, fat loss, fat loss. Testosterone and thyroid are the key fat loss hormones in your body. How many of you can remember when you were 25 or 30, missing a meal and losing 5 pounds? Remember those days? Okay, we've all been there. Testosterone is key to that, as well as thyroid hormone, and that's one of the things we deal with in this practice a lot, okay? So you will never hear from your GYN doc that you need testosterone. It is critical to your health. Women love testosterone, okay? I got suburban moms in this practice that are taking a lot of testosterone because it helps them build muscle mass. Maintaining muscle mass into old age is the key to not falling muscle mass and bone mineral density. If you don't die of cancer or heart disease, you're going to die from a fall. It's as simple as that. Statistically, that's the way you're going to go, okay? And maintaining muscle mass and maintaining bone mineral density into old age will keep you from dying from that fall. Francesca, show them your guns. Show them your guns. Come on, man. So look at that. She's 62 years old. She's 62 years old. And let me tell you Francesca's story, okay? Because this is critically important. You go to Yale Osteoporosis Clinic, those bow tie wearing, white coat wearing docs, okay? And you complain of osteoporosis, they're going to do 2 things. They're going to put you on calcium. The American diet is full of calcium. There's absolutely no reason to supplement calcium unless you're straight up vegan, okay? In which case, maybe calcium is not a bad idea, right? Number 1. And number 2, bisphosphonates. You see those advertised on TV all the time. Boniva, Prolia, there's like 5 or 6 of those now. They're all trade names for what are called bisphosphonate medications. Those medications treat one thing, a DEXA scan. The DEXA scan is the machine in the hospital where you go to find out what your bone mineral density is, okay? And those medicines treat one thing, the DEXA scan, because all they do is promote the deposition of calcium in the outside layers of your bone, the cortex of the bone. If you take a woman whose DEXA scan has improved on Prolia, Boniva, and calcium, you biopsy that bone, it looks like somebody took a salt shaker and just went like this and salted calcium in there. You take Francesca, who 8 years ago was 2 standard deviations below the mean on the DEXA scan, okay? She was a China doll, okay? As fragile as possible it can be. 8 years later, she on weight training 3 times a week, estrogen, progesterone, and testosterone. She is now 1 standard deviation above the mean, which the mean compares her to other 62-year-old women, okay? She's a standard deviation above the mean. This chick is bulletproof, okay? And if you biopsy her bone, it is all structural bone. The only thing that improves fracture rates and death from fractures is hormone optimization therapy and weight training. And I'm not talking necessarily building muscle is key. I got 85-year-old ladies in this practice doing weight training 3 times a week, okay? And they feel good, they feel great. But the testosterone is part of that. It's part of maintaining that muscle mass. So I can't stress this enough. Part of maintaining health in old age is understanding in a fundamental way endocrine failure is part of what befalls us as we get older. Lifestyle is also part of this, okay? We tend to eat. Now, eating appropriately is key too, okay? You've been hearing more, this, that, and the other thing about carbs and protein and fats and things like that. One of the things we do in our practice is we help patients follow what we call macros, knowing how much protein they need to eat, how much fat they need to eat, and these kinds of things. But this can all be taught by a dietitian or nutritionist. The science has been done about this stuff in the last few years also. And we used to talk about classic examples. We used to talk about cardio. All of us are of the age where getting on a treadmill was good, getting on the what do you call it? The elliptical trainer, running, rowing, all of these things, they're good for you because they're training your heart. So it's critically important to do some cardio, but the whole physiology community has changed the focus on weight training now and maintaining muscle mass, because now we know that this is the key to health in old age. So I'm not trying to sell you anything, but the science has been done about this stuff. And like I said, most of what we do in this practice is myth busting about this kind of thing.
Dr. Guglin, could I ask a question?
Please.
So you're talking about muscle mass in women. You're talking about doing some, 3 times a week, working with weights. Is this going to help balance? And is that why you're not going to fall?
Brilliant question. Glad you asked it. There's 4 things that leave us with old age: bone mineral density, right? Muscle mass, proprioception, position sense. Okay. We can all remember when the analogy I always use with my patients is that when I was younger, I could ski in a whiteout. Okay. I could ski in a dense snowstorm, not because my body always told me where I was. Another good analogy is when you were younger, you could close your eyes and walk down a flight of stairs. Okay. We get older, we lose proprioception, position sense, and we use our eyes to tell us where we are in the world. Okay. So proprioception and flexibility. Okay.
Mm-hmm.
Hormone optimization, weight training are really good for the bone mineral density and the muscle mass part of it. What's good for proprioception and balance? Yoga, Pilates, maintain your core strength, all of these things. Okay. Proprioception is critically important to health, but we have to manage it. We have to work on it. Yoga is really good for that kind of stuff. Okay. Right. So the more woo-woo stuff like yoga and things like that are really good for proprioception and flexibility, right? I mean, how many of us have like stepped weirdly on a flight of stairs or something and just barely caught ourselves from going to ground completely? Because inflexibility is one of the things that make it so it's really hard to recover from a fall. Right. So balance is critical, and we lose it as we get older, but we can maintain it and get it back from following some of these disciplines. Yeah. Okay. Yeah.
I wonder if I could just interrupt for a moment. I don't want to interrupt your thought process.
No, I'm not thinking anything. Okay. This is just bam.
I just wanted to share with everyone that, we did the poll on June 27th. And I'm literally checking off on my list here as you're speaking, because I wanted to be sure that we included these topics. And I'll just read you a quick list of about 10 things that you guys checked off on the poll. So the first one was incontinence, which is what brought me to your practice, and the M-cell machine, we can talk about. 8% of those who answered the poll had an issue about that. Lethargy and fatigue, you also spoke to that just now. 13% of you. Weight loss, weight gain, 13%. Early waking or insomnia, 14%. Bone density, we just talked about a lot, 2%. I'm surprised that's not higher, but anxiety, irritability, or moodiness, 10%. Lack of confidence, 7%. Bioidentical hormones, 2%. I'm in there. Mm-hmm. Hair dryness, thinning, loss of hair, 8%. Organ-related disease due to low estrogen or a lack of, hormones that we currently used to bathe in, as you said. Depression, 3%, and ADHD. I'm not sure if ADHD really falls under the menopausal thing, but
it's kind of not.
Right, but I just wanted to share that those were the top issues that you all checked off, and hopefully you all saw it. And it's why we're here today. We did the poll. We wanted to know what the issues were, and Dr. Guglin absolutely touched base on pretty much all of them. Maybe lack of confidence, not so much, but I think it's just a natural issue with the fact that you think you might fall, or that you aren't pretty anymore, or that you're overweight, or you're moody, anxious, whatever. So I don't know if you want to open it up to questions.
Well, I think the lack of confidence, let me just address that for a minute,
Please.
because it has, I think it has less to do with medicine than it does with social media and the youth culture that we live in. You know, if you're over 35, you're old in this country. And I don't want to get political about this, the baby boomers are a huge mass of elder population, and lack of confidence. A lot of it comes from the fact that maybe we feel old or whatever, but we are told we're old from the time we're 40 years old, you know, and it's terrible. With the manipulation of body composition that we see in the media all the time, you know, J-Lo, okay? Before they'll publish an image of J-Lo on social media or on a magazine cover, they'll make her hips look smaller, they'll make her breasts look bigger, they'll smooth out her skin, they'll add extensions to her hair and all this other stuff like that, flatten out her tummy a little bit, okay? So I think the lack of confidence a lot of times being told, because we're all told that we're old and we're not pretty enough, okay? That's not our fault. That's not our fault.
The other thing that.
Ageism is a big deal.
Yes, it is. The other thing that I have encountered myself, and maybe there are those of you who also feel this way. When I'm on Facebook, for instance, there are all these different doctors saying, you have to take my supplement. You're not going to lose weight again because we're over 55 and it is absolutely impossible to do this on your own. Dr. Guthrie, yeah. So, you know, that's another thing. Not only is the whole, you know, if you're not young, you're old and you're done and, you know, go home and be quiet. But, you know, the fact that there's a lot of people out there just really talking stuff and they just want you to get involved with their product and, you know,
let me tell you about how labor. We go to conferences all the time. That's how we learn what we learn, and constantly in learning mode, which is one of the reasons I love this, because every single day I'm learning something new. Okay? But you can go to an age management conference or any kind of medical conference, and in a huge room of kiosks for this, that, and the other thing, there will be at least 4 supplement companies that will offer you the opportunity to put HyperFit Age Management Center, HyperFit MD Age Management Center, Dr. Guglin on their bench-made products, most of which comes from China. And so then you can then market and say, okay, this is my stuff that's going to make you feel better, yada, yada, yada. Most of it is just horse crap, okay? Now, Gundry has a big name in medicine because he started this whole thing, and he's smart, and he can help you lose weight. But the way he's going to help you lose weight is by doing things that any physician can do, which is to help you properly, make sure that you're hormonally in balance, make sure that, you know, from a supplement standpoint, you know, a lot of the objective data that we take on patients in our practice have to do with vitamins, okay? In the 19th century, we didn't need vitamins because our food was grown in dirt. The stuff that's in dirt, bacteria, fungus, all the things that provide nutrients to the produce that we eat don't exist anymore because the produce that we eat is grown in nitrogen fertilized soil. So we need supplements because most of the food that we eat, even that beautiful lettuce at Whole Foods or whatever, is devoid of the nutrients that it had 150 years ago. So you really need to measure this stuff. Objective data. Now, what we say in our practice is that every single patient in our practice is an N of 1 scientific study. So think about that. That's the problem with allopathic medicine. You need to fit into a category, right? And once you fit into a category, there is a medicine for your category, right? Heart disease, you have statins, antihypertensives, antiarrhythmics, so on and so forth. That's if you fit in whatever category you fit into, there is a supplement, not a supplement, there's a pharmaceutical for that, okay? If you approach your patient population, each one of them is an N of 1 scientific study. You as a physician, the onus is on you to have an individualized plan for every single patient in your practice. And that's what we do here because we spend hours with our patients, right? Our patients, the patients in our practice are getting blood work a minimum of 4 times a year. So minimum, they're spending 4 to 5 to 6 hours with me sitting in that chair per year. I have patients all over the country now, so we do a lot of Zoom call stuff too. But they're spending a lot of time with me, and we are getting objective data on those patients on a regular basis, because that's where the accountability thought comes. Accountability needs to be built into a practice like this. And the way you achieve accountability is by measuring their body composition, measuring their cardiovascular fitness, measuring everything from vitamin levels to autoimmunity to cholesterol. I mean, you got to know that stuff too. Okay.
Right.
But the hormones of health, there's 20 or so hormones of health that we measure 4 times a year in our practice. And what you get measured by in that executive panel that your doctor does every year, you get thyroid, and it's done wrong. And that in and of itself is an hour-and-a-half lecture. Okay. Thyroid, and that's the only hormone that you get measured. One hormone. Once you get past, and the GYN community doesn't even measure estrogen, progesterone, and testosterone with good reason, because in a premenopausal woman, each of those changes day to day. So there's really no point in measuring them in someone who's premenopausal.
Right.
Okay. But postmenopausal, you have to measure that stuff, because if you're providing that to somebody, you want those levels to be where they need to be. And once a year does not do it. You got to do it serially over time.
Does that mean that every person who is taking identical hormones will have different levels?
Sure.
Okay.
Oh, absolutely.
So it's not a generic,
No.
you're taking this.
Classic example. Everything in the endocrine system is a negative feedback loop. What does that mean in the case of estrogen? Your brain squirts out follicle stimulating hormone to tell your ovaries to make estrogen. As your estrogen levels come up, follicle stimulating hormone goes down. One of the reasons we know you're in menopause is because premenopausally, your follicle stimulating hormone was never above 20, because you're constantly cranking out estrogen. Okay. You go through menopause, your ovaries fail, FSH, follicle stimulating hormone, starts going up. So now you see me 1 year after menopause, your FSH is 55. That is your brain screaming for estrogen. Okay. And let me tell you something. At 90 years old, your brain will still be screaming for estrogen. We see 80-year-old ladies come through that front door for the first time, their FSH is 90, 100. Now, so my goal is to get that FSH suppressed back to where it was premenopausal. Some women, an estrogen level of 35 will do that. Some women, you got to get their estrogen 180, 200 for it to do that. So following estrogen is helpful, but following FSH is really much more important. And so let's say I'm following your testosterone level. You meet a trainer that you really love and you start doing weight training. Suddenly you're consuming testosterone on a much faster level than you were pre-weight training. And then you come and see me a couple months later and say, man, your testosterone levels are 0. What's going on? Well, I met a trainer. Okay, good. Let's optimize you better so that during that weight training journey, you're getting results from the work that you're doing. You're burning fat and building muscle instead of training and seeing no results.
So at that point, you would make an adjustment.
Absolutely. Yeah.
Okay.
3 months, we do regular blood work.
You
Okay.
do
Follow
regular
you
blood.
very close.
Yes. I wanted to just explain that how I met Dr. Guglin. I was having, my sister can attest to that, she's on the call today, Cheryl. I was having tremendous problems with incontinence, and I had what they call mixed incontinence. Maybe you can explain that a little bit, but I reached out to a number of practices in Connecticut, and this was the one I settled on. And I sat on what they call an EMSELLA, EMSELLA. It's a chair, and it does Kegels for you. And I know that a lot of women think they're doing Kegels, but from what I understand, you're only about 30% effective when you're doing them. And the chair, you're 100% effective. And in a 28-minute period, you will do 11,500 simply by sitting on a chair. And this machine is doing the work for you. My sister Cheryl also went through EMSELLA down in Florida. They have what they call stay dry centers.
Oh, really? Yeah,
And
stay dry. Yeah.
Stay dry centers, and they're kind of everywhere. But and maybe that's based on the population of boomers and so forth. But I can say I had a great result because of it, and I want to do another one like in August, and I want to do another one in November, and then try and go to June again, which is when I did all that. To see, you know, if I need to do any more, but that was my introduction to HyperFit MDH Management Center, and that's how I ended up here. And then we had a subsequent conversation for me personally about bioidentical hormones, because that is a subject of interest for me.
Yeah, it's a remarkable invention, and all it is a magnet. It's the same magnet that's in an MRI scanner, and it stimulates your muscle mass. And you said it exactly right. Your doc will tell you what they. I can remember somebody telling me that, you know, in the GYN community, they'll tell you every time you go to red light, do Kegels until it turns green, right? So, and that's good advice, you know, do these Kegels, but we know, again, by virtue of studying this, that a woman who's trying really hard to do that squeeze is only managing to activate about 30% of what's called the levator sling. The levator sling is that cluster of muscles that sits between your vagina and your anus and helps you keep from pooping your pants, and it keeps you from peeing your pants. And the Emsella chair activates that levator sling 100%, and it doesn't. It's a very interesting sensation, isn't it?
It's I would describe it as a teenage rock band.
Yeah.
Took up residence in my pelvis.
Yeah.
Tapping, vibrating, movement. It's very unique and a little weird, but you
not
get used to it. Not painful. Not painful at all.
It's
Effective.
remarkable. It's remarkable. There's so many machines out there. That don't get me going on that. Everything from it's a cool sculpting and things like that, which I'm very skeptical about. But this works. It's amazing how well it works.
It's FDA.
Oh, it's FDA approved, and it's actually FDA approved for not only that, but sexual function in men and women. And we're doing our own sort of internal study on men as far as erectile dysfunction with the Emsella chair. It's hard to sell it to men because it's hard to sell anything to men because it's a weird feeling, and you can't. It's hard to convince them it's going to be helpful. Besides that, we have other probably much more effective treatments for erectile dysfunction in this practice.
Do you think we should open up to some questions?
Oh yeah, please. Yeah, absolutely.
Anyone?
Ask away.
Anyone with questions? Love to hear from you.
Don't be shy.
They can unmute themselves, right?
Yeah, they have to. They can't unmute.
This is
Cheryl have a Cheryl, did you have a question?
I don't know, can I ask a question? Or I have to raise my hand?
Michelle, welcome, thank you.
Thank you. So I have been told that I'm 72 years old, and I've never taken HRT when I went through menopause, which was now over 20 years ago. And I'm kind of having a second menopause right now, but I have been told that I can't do HRT because if you didn't do it then, you shouldn't be doing it now. Do you have a comment about that?
Oh yeah, I got about an hour. But I'll spare you that lecture. That comes from that notion comes from a study that was done in the late 90s, early 2000s called the Women's Health Initiative. The Women's Health Initiative was paid for by the US government, and they studied 160,000 women in menopause using Premarin and Provera as the medications of choice for treating menopause. The vast majority of these women were 10 years past menopause. And this is back, these women, so 10 years past menopause in the mid 90s. So we're talking, a majority of these women were smokers or ex-smokers, all right? So they already had significant cardiovascular disease, right? They were our moms. So the majority of these women had hysterectomies. Right. So they were given Premarin, and they weren't given any bioidentical progesterone at all, right?
So that's my mom. That's my mom. But for me, when I went through menopause, they were all like crazy about you can't do HRT if your mother had breast cancer. And my mother did all that and had breast cancer. And so I never did HRT then. And now what? Now what?
Now what is like I said, the science has been done about this stuff. This whole 10-year thing is a myth. You are an excellent candidate for hormone replacement therapy, bioidentical hormone replacement therapy. It has to do with bad science and specifically the women's. Let me recommend a book to you. Do you have a pencil there?
Yeah.
Okay. It's called Healthy Aging
Uh-huh.
by Neil, Neal, Rouzier, Rouzier.
Zier.
Okay. Neil he's actually an emergency room physician in Palm Springs, California, who does age management. We all know somebody who has the sum total knowledge of a specific subject in their brain, okay? Neil has digested the entire body of randomized prospective peer-reviewed science that has to do with hormone replacement in men and women, but mostly about women. And he addresses the Women's Health Initiative a lot in that book, okay? And if you read that book, it's a short book, it's about 240 pages. So it's on Amazon.com. It will put you.
I'll read it. I'll read the Cliff Notes.
Yeah. Yeah, it will put you at rest about that question. And it's out there, okay? And I'm glad you asked that question because I get asked that question a lot.
Yeah.
And the 10-year thing comes from a very specific study that was done badly using permanent Provera. Virtually all the women in the study were already 10 years past menopause, okay? The New York Times took the data, the raw data from this study, and published it. I can still remember, I was a surgeon back then. This is back in the early 2000s, and I can still see the headline. Hormone replacement therapy causes breast cancer and stroke in women. And it came from that study, and it set our health back 25 years. And it's a sad thing. It's tragedy. It's a tragedy.
I'm signing up.
Your mom had breast cancer. And one of the things that if you ever took statistics anytime in your lifetime, one of the things that you learn is that statistics plays no role in the individual human being, okay? Medicine is run on statistics, which is the only way you can run it. I mean, I'm not denigrating the use of statistics to do science, but by the same token, the simple fact that your mom had breast cancer does not indicate that you are not a candidate for hormone replacement therapy, okay? You've already reached the age of 70-something without getting breast cancer, okay? Right?
Lucky me.
And we have learned to cure breast cancer in this country mostly by virtue of what? Surveillance, right? You're getting your mammogram every year. You should be getting an ultrasound every year. If you're doing surveillance and God forbid you get breast cancer, 95% chance you're going to be a cure if you're getting surveilled the way you should be surveilled. But this notion that how old was your mom when she got breast cancer?
She was in her early 50s.
Okay, so right off the bat, she's not a genetic case, okay? Right off the bat, she's an episodic case of breast cancer. If you were a BRCA positive, if she was a BRCA
I refuse to do the BRCA thing. I don't know mine.
You don't want to know, do you? Right?
No, I don't. No.
We do that all the time too, all right? But all right, that's fine. But by virtue of you being 10, 20 years past menopause does not eliminate you as a candidate for bioidentical hormone replacement therapy. It comes from bad science and this thing that's been in the zeitgeist for 20, 25 years now, over 25 years at this point. Yeah. I would encourage you look beautiful. Why not stay that way?
I have to say that.
You're so nice. Thank you.
Beautiful, Michelle. Michelle, were you one of the people who wanted to find out about bioidentical hormones before the call? Did you answer the poll?
I did. I answered the call. I answered the poll very shortly, like maybe an hour ago, when I could figure out how to do it. And
that's old age.
It was too long ago. I don't remember. I need meds. I don't remember.
If that was one of the things that you had ticked off.
I know I know what I know. I'm interested in it. I don't remember if I checked it off. I checked off the high testosterone thing, which is like really insane for somebody my age. But I don't know about that either now. I've gotten nowhere.
Sorry. I will say that when I posted the poll, some of the women were kind of chatting below in the comments section. And there were a few women that had already been on the bioidentical hormones for about 15 years or longer. And they were saying that very positive effect for them. And
Good.
I would love to ask those women if they would speak to this topic on another day and just get some feedback from them. I know Francesca's been on it since she was 48, if I remember correctly.
I'm 62 now.
And now 62, so we're talking 14 years of, what, do you mind if I ask you? Should we turn the screen just a tiny bit? Do you mind if I ask you, like, what are the differences that you in your body and how you feel and function?
I went into menopause very young. I was 45. And then I did my own research. Then I didn't know anything about hormones. And like all of you, all of us, I was terrified of hormones because of all the bad publicity. And then I started getting hot flashes. I started feeling tired. I just didn't feel myself. So 3 years later, I educated myself and learned about bioidentical hormones, and I've been on them ever since. So I can run. I exercise 7 days a week now. I run 4 days a week. I do weightlifting 3 days a week. I lose weight. I sleep like a baby.
And I can attest the fact she's really horny too.
I have a good sex life. I mean, I'm a grandmother. I have kids. Yeah, I work full time. We're busy. We're very busy. But I don't feel like I'm 62. I think I'm 20, but I was born in April 2nd, 1962. So yeah, I'm 62.
Wow, wonderful. Thank you.
And we say 100 is the new 60, right? So
We're lucky to be alive today because there's so many amazing tests that we can do. So you can actually be in control of your health. You can be your own advocate. We offer a lot of all the cutting edge tests that are out there, but we try everything ourselves. We don't offer it to any of our patients. There's not one thing that we do here that we haven't done. So we believe in it, we practice it, we do all the tests, and we do the lifestyle that we
practice what we preach. Yeah.
Seems like a passion.
Oh, it is. I mean, how can it not be? I mean, especially when you see, especially when the DEXA scanning alone, okay? When you do a series, we don't follow weight. We follow your percent body fat. That's the way you need to follow it. How do you drop your percent body fat? There's two ways: lose fat, build muscle, right? And we advocate doing both serially at the same time. And when you see, and every time you do a DEXA scan, the last page on the report is an avatar of you, okay? Because it's an x-ray machine. So it shows you an x-ray of your body composition. And if we should put this stuff on the walls in our practice, because I cannot tell you the myriad men and women who have had serial DEXA scans in the last 8 years in this practice, who the avatar of them is just turning into a different human being, okay? A human being with more muscle, less fat, and it codifies into a large degree how those people feel as well. They just feel better. And if I had to sum up this practice in a single phrase, I say that we're a quality of life practice. And in America, we say if you don't have your health, you don't have anything. But that's bullshit. We don't believe it. Okay. The same person who, and we are a cash-based practice because Medicare, nothing pays, insurance doesn't pay for what we do here. Believe it or not, in the allopathic healthcare system, everything that we do in our practice is considered off-label. Even though it's completely 100% supported by science, everything that we do in this practice is considered off-label, all right? But we are a quality of life practice. And in America, we say if you don't have your health, you don't have anything. But that same person, we want our neighbors to be our patients. So in terms of what it costs to be in this practice, it's like a third of what it costs in those practices in Florida, those practices in Southern California, because most of our patients are people that live within 20 miles of us, although we do have patients all up and down the East Coast, on the West Coast and stuff like that now. But the same person who doesn't want to spend a little bit of money in our practice spends that same amount of money at Cheesecake Factory or someplace like that every month. Okay,
Interesting.
or on cigarettes and beer or whatever, go ahead.
I just wanted to add, like, our children are having kids much later than we did. So I have a grandson that's 6 months, and I just realized, oh my God, when he's 30, I'm gonna be 92. My son has a mortgage, and I'll be 92 when he pays off his house. So I want to be here and celebrate those things. So that's my determination of why I try and be healthy,
Right.
so I can be there for all those milestones that I have to look forward to.
Grandmother, still right above. How many of you, anybody who's here, knows somebody who's 62 years old who could never keep up with a 3-year-old? Okay, how many of you know a man with a 48-inch waist? Visceral fat is one of the things we follow in this practice. Visceral fat is the fat that's inside our bellies that is extremely metabolically active and is singularly responsible for the diabetes epidemic we're in the middle of in this country right now. So what I say to patients all the time is I say, look, you want to be that grandmother who can be a great grandmother, number one, but number two, who that grandmother whose child allows you to take care of her children, who is still who's still capable, who's still capable, who's keeping up with a 3-year-old or a 4-year-old. And I know that right off the bat, if you think about it, you can take off 4 or 5 people who are your age that are singularly incapable of doing that. That's what this practice is all about. That's what this practice is all about. When we practice with the future, we try to.
Right here.
Yeah, what's that? Yeah, I know. Look, I wanted a new monitor anyway.
Okay, there. Anyone else have any questions? That was a great question, Michelle. Thank you for
Yeah, thank
bringing
you very
that up.
much. Yeah, that's key, because the whole 10-year thing goes, the whole 10-year thing goes with people telling you that 10 years post-menopause, you can't do it. And the other myth is that you can only be on hormone replacement therapy for 10 years and then you have to stop. And both of those are bullshit. Both of them. Yeah. Thank you.
Maureen, Brenda, Michelle, anyone with questions? Cheryl?
People are ticking off one by one here.
Yes, we said 6 o'clock or 6:30.
Yep.
And we're heading into 6:35.
Yeah. All right. Why don't we wrap it then?
Okay.
Yep.
I'd just like to say thank you to the Ethel Gathering Group of Connecticut for coming on the Zoom call today. I hope this was informational for you. I actually hope it's life-changing, and that you can reference this video on our files at the top of our page. If you scroll along where it says chat, discussion, events, featured, there's also a tab called files. And we're going to keep this Zoom call on that tab so that you can revisit it for your own information, but also our new members who were not able to be here tonight, or the current members who have something else going on. So thank you to Cheryl for running through the test with us and making sure we were up and running, and for all of you that came today. And obviously a big thank you to Dr. Guglin and Francesca for having us today and doing this, because I think it's great information. We need to know about it. And anything further?
Just you're welcome to call us, and you can come and speak to us. It's a free consultation, no obligation.
Right.
Yeah, the HyperFit MD age management information is on the initial poll, and it's also on the event that was scheduled for today with contact information. The HyperFit website is there as well. So anyone who needs to be in contact with Dr. Guglin or Francesca,
Thank you too.
by all means, do so. And thank
Thanks.
you so
Thank you.
much.
Bye.
Bye-bye, everyone.